So thank you. Welcome to Nupsala Learning. And today we're going to be interviewing Jackson, the CEO and creator of Incrediwear, this product that Nupsala has in our pharmacy. And we're going to be taking you through the product and how this groundbreaking technology has really revolutionized how athletes, both human and equine alike, are really using this product to optimize its recovery, recover from injury, and really being a sort of a tool for any athlete or any performance rider that's trying to get the best out of their horse or themselves. So I introduce you to Jackson and really take it from him to lead you through his own product. So thank you, Jackson, for giving up your time today, and really looking forward to hearing this from the horse's mouth, pardon the pun.
I love it. I love to actually share what's going on, because really we're at a time where we're actually searching for products that are game-changing in the fact that they're not using medication. They're able to actually have a physiological, a biological, a chemical effect at a cellular level. And it has zero side effects, and you're able to actually wear the product 24 hours a day. And what's great about this is that we're coming in today where, you're actually selling and utilizing and teaching and not only giving this product or having clients use this product that are equine athletes, but you're also knowing that the rider is just important, and we have products, for both. And I think the lead into this is we should really chat just a little bit about how it all started, because really we weren't in equine 3 years ago. We were only in the human side. And so I love to tell you and take you through this story of how we started by taking a look at, where we came from and what we're doing and how we're trying to change the world. But at the heart of it is, how is it working? How is it continuing to working 24 hours a day, even when the horse is asleep or the human's asleep? And how this is going to have amazing effect on your ability to recover, your ability to perform, and your ability to actually, as a human, live life to the greatest, and as a horse, to actually get the best out of that your horse that you have, and that there's no inflammation, there's no potential to create problems from secondary compensatory issues with mechanics. And so today, as we speak, we're going to go over not just what the product does, but we're going to go over studies showing that we actually improve or prevent injury by 67% in soccer players and 90% in basketball players. It's crazy. Now we're looking at how we can prevent injuries just by wearing the product on equine, on horses. So there's so much there.
And for those who haven't seen it, it basically looks like a garment. It's material, isn't it? I mean, it's either in a bandage form or a wrap form, fairly comfortably fitting. But we're talking about all those benefits that you get from actually wearing what would be a piece of material. This isn't a drug. It's not something that's invasive. It's not something you put in a food. It's actually what you put on, correct?
Absolutely. And you just brought up a great point. It's not something you're putting inside your body. It's a wearable anti-inflammatory pain relief for humans, and it's a wearable anti-inflammatory for horses, because the horse can't speak. But we know that all the studies that we're doing is you put the product on, it gets rid of lymphatic inflammation or interstitial, interarticular, intermuscular swelling. And when you get rid of the swelling, now all of a sudden oxygen and nutrients can come in with the increased blood flow that the product brings to be able to allow your body to heal faster. And that's why dramatically, as we go through this today, you're going to see we increase the recovery rate by up to 46% faster recovery for humans. And when you do that, if it's a world-class athlete or a world-class athlete horse, oh my God, that's saving so much money. We're on the Real Madrid, the soccer team, and how we got on them is we took one of the lead doctors there, put a product on one of their $10 million a year athletes, and what happened is they healed 10 days faster. That was $10 million they saved by allowing this person to heal faster. And so I think we're going to look at that, not just on, we want our horse to be amazing, but what does this mean for you, in the long run, keeping this horse, fit, keeping your body fit, allowing your body to, work at 100%. So I want to show you some of the things that we do, and I want to show you who's using it. We have some of the most famous people using us, and also in the equine world as well. Many of the top dressage and jumpers and hunters utilizing this, but to see that people use this and they're buying the products themselves is, kind of a sales tool itself.
Yeah. And I'm not going to jump ahead again about what you're about to present, but for me in our work here at Nupsala, we get involved in a lot of treatment and treatment strategies, working with vets who obviously are then going out and treating sport horses or athletes. For me, we always understand that drugs will work for a certain amount of time and then they peter off. Physical application does exactly that. You get to apply something for so long and then it has a effect for an amount of time. So a lot of the time we get in this sort of recovery and then it kind of pitters off. You get this sort of decrease in effect and then you apply it again, or you take another medication and it does that again. What I particularly like about the Incrediwear range is that you can apply it all the time. You don't get that drop off in the effect. And I think what you're alluding to, and the reason I pointed it out, was that when we talk about faster recovery, it's not replacing things. It's a different way of approaching it. We've always looked at what's the best anti-inflammatory in the market, or how do I achieve the best results. What I particularly like about this is the ability to apply it all the time. So after the vet has done what they need to do, or the physio has done what they need to do, this can be used alongside or with that to maintain that anti-inflammatory strategy. That in turn is going to lead to a faster recovery.
Absolutely. And you said it really eloquently, is it that we're an additive. Almost every study that we do, you add us on to whatever therapy that you're utilizing. There's not just one thing that can actually be a miracle, so it's a product that is going to reduce the inflammation with the person sitting in a chair, yeah, with the person sleeping, with a horse just standing still. And oftentimes when you take something internally, it's going to be divided up, through your body, into smaller, components. And if it's a painkiller or even an anti-inflammatory, doesn't always get to the targeted cell. And I think we can go a step further too, is that we're very big in regenerative medicine, because the first thing that happens is that it creates inflammation. If we can actually help with that, reducing the inflammation, now the targeted cells or the targeted product that they're trying to introduce to an area can get to the targeted cells to allow them to heal faster. So this is an exciting day, because we're going to learn about a lot of stuff, and it's one of those things where if we don't educate you enough on this, and you don't have questions, I'll be really surprised. This is going to be a good learning tool. So let's go ahead, and I'm going to, when I started this company, I did it because I actually personally flew off a cliff mountain biking, and I've got 5 herniated discs in my spine. I'm not going to spend too much time on this, but I was in a walker and a wheelchair in 2009. And at that point, I needed to do something to heal me. And I had one of those aha moments where I was a chemist as a background also in chiropractic and sports. And I developed a product for my back that allowed me to move, to have less pain, to accelerate my recovery. And as a result of that, in 2010, we launched Incrediwear. And this is the whole story. When we take a look at what I'm going to show you, who's utilizing this product, I want to do this just to show you how powerful just one person using the product, then it moves to the next person, to the next person. When you have the ability to recover fast, it's a miracle. And for these people, and horses that we're going to talk about, is that if I can just be an additive, even if it's just getting rid of inflammation, then what it's going to do, it's going to make the veterinarian and the doctor and the trainers happy.
Okay.
So when we take a look at some of the athletes, I'm just going to show you one of the most famous in the world who has a really good story, because she's been using this since her first injury. And we'll just go ahead and watch Lindsey Vonn as she crashes, recovers, comes back, and wins another World Cup. Now, if you watch this, you're going to see her wearing our knee sleeve for all of her recovery. There it is.
I'm not done yet.
And why this is important for me is that she said the right words. I'm not done yet. And I think that's sometimes when we have an injury with our horse or with ourselves, it's like, okay, I got to put myself on the shelf for, 12 weeks or whatever. This is what our goal is. Our goal is, how can we accelerate the recovery time? How can we get us back, or the horse back, faster? And that's what this number is right here. It's 46% faster recovery when using our product in combination with other treatment. And what 46% means is, instead of 24 days to recover from an injury, now it's 12.5 days. 12.5 days to come back. How can that happen? It's like a miracle, because now you can start rehabbing faster. You can start getting stronger, and there was zero re-injury rate in the study. And so I think we need to remember these numbers is the amount of recovery from an injury depends upon how much and how effective you can actually treat the injured, horse or human.
Yeah. And we all know how long horses take to recover. They're a very big animal. Typically the injury is cumulative because of the forces and the size of the animal involved. So our removal from the sport that the horse is doing, whether it's racing or eventing or any sport use, is normally quite a protracted period. And, I think everybody who's involved in equine sport medicine, or even if you're owning a horse that's in athletic use, you all know all too often how career-ending sometimes a simple lameness can be. Some horses will take up to a year or more to recover from certain conditions like tendon injuries or even joint disease, or ongoing management of the disease can really be career limiting. And then all too often, that's the reason that the horse is taken out or retired, because not the injury, but the length of time it takes to recover from the injury.
Yeah, that's a really important point, because the faster we can get somebody back, life is motion. The faster we can get them back, the faster that we can get them moving, ambulatory, the less chance of getting arthritis. And when we take a look at some of the famous people using our products, we don't pay these amazing multi-million-dollar a year athletes to wear our products, but they're posting pictures wearing our products, because what they know in the long term is that if you are non-ambulatory, or you're letting a joint sit, or you're not recovering, the next phase of recovery is scar tissue. It's degeneration, it's arthritis. And we're really lucky, because in the UK, in Grantham, we were able to do a study on humans on arthritis. And it really does correlate with every living animal. Is it, if you can reduce the inflammation, you're going to, in a joint, you're going to reduce the chance of having that degeneration occur. The same thing is true in a muscle too, Greg, is that if we have a muscle tissue that's swollen and stretched as a result of an injury, instead of having annular fibers come in, striated fibers, what you get is you get a mesh fiber, which is it's called scar tissue. And so then after it's finished, it doesn't stretch as much. So if we take a look at it, it looks like fingers woven together, when actuality the regular tissue works just like your fingers spreading apart is that as it contracts and it comes back, it stays and stays longitudinal. And when that happens is it allows that athlete, be it a horse or a human, to actually move without any what we call proprioceptive issues that are receptive issues that say, hey, the muscle's shorter. The muscle is, if it's too short, it's going to create a problem somewhere else. And because there's 4 legs on a horse, is that you're going to get more compensatory problems than, say, even a human. And that's why I think we're on the tip of the iceberg as far as medical, as far as helping these animals. And so 94% is a number that is how many people actually responded wearing Incrediwear for osteoarthritis changes for grade 1 and grade 2. So they were injured, they started getting arthritis. 94% got better using our products, even over a sustained period of time. But not only that, the level of pain went down almost 60%. And that being said, is when you're in pain, you can't move very much. And I think the same thing is true on a horse. Is that correct, Greg?
No,
when you're in pain,
pain is a limiting factor. Pain's there for a reason. It actually stops you doing something. It's a primary function of disease. It's to prevent the body from over certain or over use of an area that's obviously diseased. So as much as we don't like it, it's there for a reason. It's also an indication of disease. We often refer to osteoarthritis and any other condition that has pain. People don't see the disease, they see pain. And they refer to the pain as the problem. The pain is not the problem, the disease is the problem. Pain is a symptom of the problem. And if we don't treat the problem, we're not treating the pain, if you see what I'm saying. So quite often people see no pain and they think there is no problem. Quite often where there has been pain, there will still be a problem. And if we're not addressing that as disease management, so yes, you've got to look at pain. It can be debilitating. It can stop a horse in function. It can also lead to reduced stability. So this is where we get poor performance coming in. But also, you don't know when that subtle pain is starting to come in. So if you know that your horse has got pain or has pain issues because of disease, then your overall management should be to safeguard against pain coming back because of the disease, and what causes pain is the disease.
Yeah, when you see these, you're working with the horses and they're sedentary, just they wake up in the morning, what does that stiffness do? And why is the stiffness there is the biggest question. They're standing in one place, for overnight.
You're opening up a can of worms, an absolute can of worms. And that's because a horse is supposed to be a free roaming animal. If you were to put a GPS tracker on a horse that was out in the field overnight, you would be amazed on how far it moved. Now, a horse is, its lymphatic drainage is very much linked to its movement, its motion. The frog in the foot is part of that pump mechanism to get the blood back up the leg. It's a very long distal limb. So all of these factors really lead towards a horse's natural environment is out roaming and eating. And we go and stick it in a 2x2 box. It'd be like you and I living in the bathroom for 23 hours. And that has got problems. These horses are not walking around, which means its normal function of getting blood supply down its limb and back up its limb, and how a horse would naturally recover from any form of exercise, is reduced. So yeah, you would absolutely open up a can of worms about why we keep horses. And really what we're doing is we're making it easy for ourselves. we don't want them getting dirty. It's you know, we're safeguarding our prized possession. We stick it in a box. It's almost like sticking it in a cabinet and we look at it. That's not where a horse should be. But yeah, we have to deal with the side effects of making a horse live in a unnatural environment.
Well, this is, you know, this kind of leads into what we're going to be talking about is that the amazing part about what we can do as an ancillary part of the horse's care is that you said it, the horse has to move the lymphatic system. But on humans, we've already done the studies. We can actually move the lymphatic system at rest while at sleep. So sitting in a chair, standing in a room, your product, your body moves the lymph by muscle contraction. Horses don't have muscles, you know, all the way down the leg. You know, it stops at a certain level. So there's a lot of pooling, you know, of blood, you know, on horses. So on humans, you know, it goes all the way down. So when you see somebody that's had, say, breast cancer and the lymphs removed, you see the entire arm is swollen. And when the entire arm is swollen, the only way to pump it back is to contract the muscle. Yeah. What they've been doing is put compression on it, but compression actually collapses the lymphatic system. It doesn't allow any motion. It just kind of squeezes everything out, and then you take it off and it comes right back. And so we aren't compression. And you'll notice that one of the products we have is the hoof sock. And they always say, wow, it's just, you know, it's just touching the skin. Well, yeah, that's all
right here.
Yes.
Yeah, it's not compressive at all. It just overlays that distal part of the horse's limb. And like you said, it really is that area that we know has no muscle. This is all bone and tendon down to the fetlock joint and down to the foot. You know, above the knee, there obviously is muscle, but this is that area. And it's also the area that we always associate with that puffy leg syndrome, that Monday morning after a hard weekend's worth of competition or hunting or something, we get that puffiness. And we know too well that if the horse was to go and exercise, it would reduce. But I'm sure you're going to touch on it, that deleterious consequence of all that fluid sitting there because it can't move.
Absolutely. And, you know, I always think one of the studies that I want to do is that if you ever, if you can remember, we used to put weights on our feet, you know, to go and exercise, to make things, you know, we think that it's going to make our legs stronger. It was a really big fad for a while. And, you know, then you take them off and wow, your legs feel lighter. Well, when you have that extra swelling in the legs and then you go exercise them, that's extra weight down there as well. There's, you know, it's actually a harder pull on the heart. The heart has to work harder because there's more fluid down there. You can't get rid of it. There's so many different things.
Yeah, I guess we never thought about that.
Yeah, so we're actually looking on humans. What we're studying is that the three new things that we're studying is one is if you have the swelling and you go exercise, what's going to happen is you're not going to get oxygen and nutrients to the cell. Two is if we increase the heat, that increased heat actually causes vasodilation, which causes even more swelling in the area of the cells that need oxygen and nutrients. You know, and then the third aspect of it is that if we can actually take a person and while they're exercising, lower their temperature, what is the long-term effect as far as injury is concerned? And it's great because most athletes get injured either in the first quarter of a game or the last quarter. The first quarter of the game, it's because they're not stretched out. And then the last quarter, it's because they're fatigued, because there was swelling and muscle injury and muscle use during the game that made the muscle actually have swelling around it. So the horses are the same. So that's why I love this. And as we get into seeing, you know, we're just going to run through a few athletes that utilize this so you can see how amazing it is. We pay no athlete to actually even take a picture with our products, but they send them. And then what I want to do is immediately get into how's this work? I mean, we really haven't even talked about, it just looks like a piece of material. It looks like clothing that you wear. Oh. I have to admit, I slept in all my clothes last night that were, you know, Incrediwear clothes. And when you wake up in the morning, you feel amazing. But the last few nights, I actually put our are standing pillow wraps underneath my sheets, because I want to make sure not only are the parts that are exposed that I don't have Incrediwear on are actually touching something that's activating the mid-level infrared optical waves that are in the material, which we're going to talk about next. So let's get on this, and then we'll talk about how it works. It's really kind of amazing what you can do, and the effect that it has on it. I'm going to play only 2 more videos. This one actually, I just want you to listen to what this gentleman says, because it's all about performance and recovery. We don't pay anyone to do these things. We didn't pay this guy to do it. He just wrote about it. He's an amazing athlete. But this is what your horse is doing when it's out jumping, when it's out doing dressage. It's the same thing, and you'll see what he does, and you'll see and listen, because I think he's the horse talking that you can't actually hear. Here we go.
Incrediwear has made my performance, my recovery, all my training, everything so much better. Efficient recovery equals efficient performance, and that's exactly what I always push for. Constantly trying to better myself, and that definitely requires a lot of time, a lot of dedicated hours of actual practice and training. Lots of repetition is necessary to be able to perform on this level, and that definitely takes its toll on the body, which is why good training habits are smart, but performance enhancing and recovery enhancing products are also very helpful. I think Incrediwear is definitely at the top of the list of things that keep me going, keep me moving, and feeling great all the time. I don't have lots of aches and pains. My joints feel good, my muscles feel good, everything feels good throughout and after training. And that's something that I think I've needed my entire career, and I'm happy to finally have it. It's taken me to the next level, and I'm very appreciative of that. Incrediwear is the next level itself.
If I were a horse, he is the horse speaking. Everything that he said about how you feel, how you train, to be able to feel amazing every day is something that we can't get into the horse's brain and ask. And on an athlete, when I start out many of my talks to professional cycling teams or NBA teams or whoever it is, orthopedic surgeons, I always say the first thing that we do is we judge our day when we are in bed waking up, and we start moving each body part thinking, oh man, today I'm not as tight. What happened? Wow, I went for a 5-mile run yesterday, but wow, my legs are feeling good. Or, that knee is swollen today. It's tight. I can really feel it. Horses are doing the exact same thing. You're coming out there and they're going, do I want to actually go and jump today? Do I want to, we need to get into the horse's head. And if we could, that video is exactly what your horse is saying. It's exactly what every athlete's saying, is that we need products that are going to enhance our ability to recover, to perform, and to live each day to our fullest. And he said in there, it takes, to be at the top, it takes repetition. It takes constant training. And when you're at the top, you're also at the top of level of when you're going to get injured, unless you're doing things that you're going to help enhance that recovery. And so on humans, of course, we reduce the swelling, we increase blood flow, and we reduce the pain, and that accelerates the recovery. And when we take a look at what we are, is we're a semiconductor embedded inside the fabric. So when you take a look at any of our products, you're saying, oh my God, there's a semiconductor inside. This is like a computer. Well, yes and no, is that a computer needs to be plugged into a wall, and it needs electricity to perform and to work, to release the optical wave to be able to make your computer work. And as you're watching us right now, on this video, is that the diodes that are inside the TV or inside the transistors are all germanium diodes. It's the fastest computer chip, it's the fastest semiconductor, and it's the fastest ability for you to transmit information that's how you can actually see us right now as we're talking. And we've been able to embed it inside the fabric. And when you embed it inside the fabric and you put it on amazing athletes, you don't actually need to have a study or anything. You can just put it on the athlete, and the athlete speaks to you. You know, from a Ronaldo to, you know, the U.S. Olympic ski team to, you know, the top NBA players or Olympic teams or cyclists. It's amazing and gratifying that the athlete, none of these athletes know how the product works. I have to tell you that, you know, I'll talk to them and they don't know how it works, but they put it on, they go, oh my gosh, man, I feel amazing. And when you feel amazing, that has an effect.
I was going to say, you've picked up that point, isn't it? That, you know, we can look at these top athletes, these amazing people. They are absolutely tuned into their bodies, 100%. They've got a team around them, dietitians, you know, the guys who are doing all of their training, the sports coaches, you know, they've got a whole army, some of these people around them. And their bodies are like a highly tuned Formula One car. Exactly the same for the horses. You know, we look at performance horses at top level, or even right down at your pleasure horse where you're trying to optimize and train going forward, is that what I take from these guys and girls using this product is that if they didn't think it was having an effect, they would know very quickly because they're so highly tuned. They're using that product because they can feel that difference, and they're then using it to reach for that next level, to take them up to that next level, their ability to combine their training and not be able to slow down that training because they're recovering. We've touched on that already. I think the horse is exactly the same, is that if we were to put this technology, it's not a piece of material, it's a technology. If we put that technology on these highly tuned horses, those who evolve around them training and responsible for their training and their outcome, they're going to see the difference. And that's what we've had back already with the positive feedback, is that this is a product that you actually visibly see the difference. You're not looking for the difference. You either feel the difference or you're going to see the difference. That's what I take from those athletes, Jackson.
Absolutely. And when we get to the next level, it's the medical professionals and hospitals using it. And they want the science, but they too are just like the athletes, is they use it on patients and they go, oh my gosh, this person's healing faster. We want it. These are some of the most famous doctors in the world, is that if you can use a product that does that, and we don't sell our product, by the way. We don't go in and go, oh, we want to sell this product to you. What we do is we say, here's a sample. You go put it on your worst athlete that's not getting any better, and then call me tomorrow and let me know how that person's doing. And it's like, oh, every time it's like, oh my gosh, this is crazy how it works. So what we need to do now is, and this is what I'm doing, is I have almost 20 studies that are either finished, going, or ongoing, and I got 3 more this week that were approved, and 5 more that are in the queue that to the line to be able to the queue to be able to get you know the studies going on different conditions that are not even related to the horses or the humans. It's prostate and it's chemo-induced neuropathy and it's all these other things, because it's the same. It's the same for an athlete to heal as it is for post-surgery, as it is for a diabetic. It's the same. It's just that now we need to master it. And so now we need to, you know, we're going to get into the science. I hope this, you know, we'll try to keep it not too heavy, but what do you think, Greg? How deep do we want to go on
people, you know, I think any veterinarian who's watching this will appreciate the science. We can always have a different presentation for that level. But I think as this is an intro into the product, we've got to touch on the fact that what we're targeting here is inflammation. What is inflammation all about? How much is inflammation a problem to our body? It doesn't matter if we're recovering from a single injury to like a tendon or a muscle or a joint, to, as you've already touched, Jackson, inflammation can be a systemic problem. It can be a problem associated with ongoing disease. And so many diseases in our body have got a component of inflammation. It's how the body kind of recovers, but also it's part of the disease process itself. So I think what we're looking at here is if we can get into how this product tackles inflammation, we can then use this product in many, many aspects to help animals, horses, or even ourselves, because we're going to touch on the human side as well, deal with day-to-day, daily living. Daily living is difficult. God, we're all cooped up at the moment. It is difficult times, and how we deal with that information. If you can understand information, you then understand how this product works. So go for it. I know you're a whiz at this. Go for it.
Well, it's funny. I just, we do a lot of incredible teams around the world, but I was just lecturing just recently in Spain with the EF race team for the Tour de France. Hopefully the Tour de France happens this year. They use us for recovery and also performance. But when we take a look at those athletes, we want to start out this way. When I'm an athlete and I go and exercise, be it a horse that's top level or a horse that's not, or a human that's just everyday weekend warrior, or someone that's just, getting going, in athletics, or someone that just had surgery or has arthritis or has diabetes, the process is the same. And we need to understand this. And every vet that we're talking to today understands this. It's called the cascade response to injury. Yet it's the cascade response to not only trauma injury, like if I punch you in the eye, or, if I have a cut. You see this picture on the screen is that we're shoving a knife into your skin to show you what the inflammatory process is like. But it's the same. If I'm an athlete and I'm running or I'm training, every day I'm tearing muscle and I'm rebuilding the muscle. But at the same time, it's the inflammation that takes place that all these doctors think, oh, we need the inflammatory response so that we can build more muscle. And they're right in a certain extent, but they're wrong as well, because you don't need the entire inflammatory response. The inflammatory response came millions of years ago when we were created because we didn't have casts around. So you injure yourself and you don't have a cast, you get heat, swelling, pooling of blood, and it actually limits motion. It doesn't allow, so if you fractured your arm or cut your arm, you don't want to move it right then because it might open the wound more, or it might break the arm more. So that was it's an inborn inflammatory response that now we found out that you don't need the beginning part. Because really, if I have a tsunami that comes in and goes into Japan, and all of a sudden the water recedes and all this garbage is on the streets, really, how are you going to actually move on those streets? How can you get a car around when there's a tree laying there, or a building, or a boat in the way? And really, when we look at trauma or even post-surgery, it's the exact same thing, is that when you have that dramatic first push, it's like a tsunami wave that comes in and brings all the garbage with it, and all the materials of damage from muscle degeneration. And we get chemicals, and Greg, you're going to talk about this, biochemical markers, which can be CTX or MMPs or whatever we're measuring, is that you get these inflammatory injury. It's almost like having a clogged toilet. Everything gets stuck in one area, and yet healing only takes place when the swelling goes away, so that oxygen and nutrients can come into the cells to be able to fire up the mitochondria of the cells, to allow every part of the metabolism that's inside the cell that's going on without any oxygen, because it's surrounded by all this tsunami wave damaged structure. Nothing can get in, nothing can get out. And so essentially what happens is the cell is struggling. What Incrediwear is doing is it's taking the first part of the inflammatory response, which is the heat and the swelling and the pooling of the blood, and it's not allowing that to happen. How could that be? Well, Incrediwear is embedded with semiconductors that release a mid-level infrared optical wave. It's vibrating the cells, just like if I were, contracting a muscle. The muscle never stops contracting because it's vibrating. And when you do that, we measure the amount of pressure inside your tissue. And what we found is it's pushing everything without compressing into the lymphatic system, the sewer system of the body. So what we're doing is we're controlling the heat. We thermoregulate, which we're going to get into in a little while, is that when you put our product on and the hotter you get, it keeps you cool. you don't have heat, you don't have vasodilation. The next part of it you see on here is that the prostaglandins, the histamines are released, but the capillaries dilate. And when the capillaries dilate, everything leaks in to the surrounding tissue. If we don't allow that to happen, now what happens is you have blood coming in, oxygen coming in, nutrients coming in, and they're going right to the targeted cells. And at the same time, just like a muscle contraction, it's pushing everything in the lymphatic system. So it's just like a river, or just like any system that continually has fluid moving in it. It just keeps on moving. The problem with the inflammatory response post-injury, post-workout, is that doesn't happen. You know, when you're exercising and you take that horse, you work the horse and you take them over into the stall, they're hot. You can touch their skin. It could be 45 degrees Celsius. When that happens, it's going to cause vasodilation. That's going to cause more swelling. Yeah. Now you're sitting the horse and just letting them cool, and there's no muscle contraction. There's nothing moving, the lymphatic system. It's the exact same thing that's true on humans, is that's what we do is at rest, we're vibrating the cells to move the lymphatic system so that more blood and oxygen and nutrients can come into the area. Now, why is that important? Because the blood brings macrophage, it brings chemicals in, it brings oxygen in, nutrients in to help the body heal faster. That's where we've always limited our thought that we need the inflammatory response. And I say, yes, you do. You need the end of the inflammatory response. You need to have all these macrophage. You need to have, all of the debris taken away. But what if the debris didn't even have a chance to actually accumulate? What if the tsunami came in and right behind it was a fire hose or a gigantic system that came and cleaned the streets before it even had a chance to actually dry out and all the mud was there? What if that could happen? Well, it's happening, and that's Incrediwear.
Yeah.
So how does this work? Go ahead.
I was just going to say, because that's exactly it. And people understand that swelling occurs at the initial stage of the disease. And, you and I have spoken about this for a long time, about the chemical markers, the actual cells that are involved in this. And I think we all have a general appreciation that inflammation is a good thing initially, but it hangs around for too long. And then there are deleterious aspects. So some of the things that break down those bad, destroyed or disrupted tissues, that cleanup phase that you're talking about, that's all there, that enzymatic breakdown. But that can also then have a further impact on healthy tissue. So they start to then attack those healthy tissues. And there's sort of a next wave of destruction of healthy tissues if we don't remove that inflammation and help the body recover. I love your analogy about the sort of the roadblocks and the tsunami effect of things going on, because a lot of our strategy initially was to perhaps cause a vasoconstriction. So for me, that's a bit the wrong way around. It's also counterintuitive because it kind of has a roadblock, but like all roadblocks, everything that was going to go there is still waiting to go there. At some point you're going to release the roadblock and then it still comes in. For me, I do like patients to maintain some degree of exercise. We do like to keep horses now, rather than stall rested completely, a form of movement, a form of physical effect. And I think that's what we're talking about, is if we can keep the blood moving, keep everything moving, how do we benefit that? We then almost suck out at the same time all of those build up toxic elements that you're talking about with inflammation, and we can get into what we call the anabolic phase. We've got the catabolic phase and the anabolic phase, and that's the difference between that inflammatory part and the recovery part. So yeah, if we can keep things moving and at a steady pace, we're not trying to increase the vessels, we're not causing a vasodilation, because sometimes people get that confused. Are you creating a bigger vessel to make things move? No, absolutely wrong, because if you were to increase the vessel, I don't think people understand that vessels are actually quite holy. It almost looks like a lattice effect. So when these vessels actually increase in size, they kind of open up, and that's how things get out of them. So we don't want vasodilation. At the same time, we don't want vasoconstriction, because that just creates a block. We want normal vessel size and nice flowing blood through it, which I think is what you're going to touch on, how this works.
Absolutely, 100%. And we've gone to the next level since we talked last, Greg. So it's really, really exciting what we're doing, because we're actually even working on exposed tissue trauma. Because in that way, you're thinking, oh, I want to vasoconstrict right away because there's tissue that's exposed, but the blood vessels bringing clotting ability. And if it's not getting to the tissue that needs to clot to stop the bleeding, guess what happens is that you're actually going to create more of a problem. And that's where we look at scarring. We're looking at scarring post, like post plastic surgery, post injury, when there's a scar from post surgery from total knees and so on. We're finding the scar is almost nothing because we're putting it on. And that's one of the next things we're looking at is bandages. But let's you touched on another thing that was really important, that when we take a look at this vasodilation, there was this guy who came out, it was a PT, really, it's been on the market for years. It's called RICE, rest, ice, compression, and elevation. And this gentleman who created this years and years and years ago, you want to rest it and ice it and compress it and elevate it right away. He's now saying, uh-oh, you know what? My theory, actually, you shouldn't go by that, because now we're finding, too much ice is causing that, more tissue damage. Yeah. Just for that reason. Compression is actually not allowing anything to get into the area. Elevation is actually not a bad thing, but rest doesn't make sense. The post-surgery on total knees that we have, the surgeons take and they're putting on our product right after surgery. This is what we use, post-surgery on total knees. And the person's walking in two hours. They have them walking that fast because now they're finding the pumping action. The reason why the surgeons love us is because the moment the person stops and is not pumping, they're still pumping. Or the person's sleeping, they're still pumping because they're wearing our products. And that's why we're doing studies on total knees and ACL and all these different, conditions. Let's understand the science. Yeah, you ready?
Go.
Okay. So this, like I was telling you before, that I had an aha moment. I really didn't know how this worked when I first was doing this, because I was studying semiconductors for a different reason. And then because it was the fastest computer chip, and I wanted to have the fastest computer chip in my computer. It came out in the late or mid 2000s, germanium as the crystalline form for semiconductor. And then at the same time, we're trying to find something that is going to reduce inflammation. And so I came across this, it was really kind of by accident. And a couple of years later, we figured out how it worked. And now we have the study from Boston University that is, the product is releasing a mid-level infrared optical wave. If you take a look at near infrared wave, that is what you're going to get in laser. And of course, you don't want to put laser on 24 hours a day. And then when you use carbon as a semiconductor, that releases far infrared waves. And so what we do is we take the two, far infrared and mid-infrared. Mid-infrared is a little bit more like a turbocharge on your car. So that particular wave vibrates a little bit more active. And so what this product does is it never stops vibrating your cells, releasing the mid-level infrared optical wave. And it's a negative ion that's attached to the outer shell of the molecule. And so we can get into what we're studying on that, but it's germanium plus body heat. We don't have to plug it into the wall with carbon. And these are in crystalline form. They never change, just like the semiconductor in your computer. It's always a semiconductor. Once it's in that form, it never actually changes. So it never stops working. It's kind of like a rock. It doesn't have a half-life because it constantly is bringing on the electron back into the molecule as it releases off in the mid-level. And when it does that, it creates this vibration. And the vibration is in every cell, not just blood cells, but it's every single cell of the body. And when you take a look at it, on a cellular level, is that normal blood flow is encapsulated in a tube. And when you add vibration to it, it could be ultrasound, it could be all these different things. What does it do is it creates more energy, but there's not any heat associated with it. So essentially it keeps the same diameter of the blood vessel. We actually now go and show you, we look under a microscope, which we'll just show you in a few minutes, of how this works. But now we found out that you can actually put it on any body part along the artery, and it'll increase blood flow and blood speed. So here we have, this is actually a human product. When you put the product on, the body heat only has to be about 14 degrees Celsius, and it starts activating the molecule inside the material and releases this mid-level infrared optical wave. It goes in and it vibrates everything, not just everything that's in a tube or in the blood vessel. We can actually measure that with laser Doppler, which we've done on horses. 30% increased blood flow. On humans, it's 30% increased blood flow as well, but it's also vibrating the interstitial, intermuscular, interarticular spaces. And when it does that, that creates more pressure, and it pushes everything into what's called the sewer system of the body, which is the lymphatic system. So it pushes everything into the drain. It's kind of like taking a hose and pushing it along. If you take a look at traffic in Los Angeles, everything gets backed up. You can't get to the location that you want. They don't even tell you it's 30 miles to get to a location. They say it's 2 hours, because it takes so long. Well, that's slowed down. In Incrediwear, we take away the swelling that's inside the tissue, and the blood can get to the area faster. And if it does, that allows healing to come faster. And when that happens, we have an amazing result. We can actually look under a microscope and see what happens.
We're going to be filming what actually happens when you place an Incrediwear product on a person. We're going to be evaluating the capillaries. The great part about this is that you can actually see what happens. We're going to see the capillaries moving very slowly at first, and then what will happen is we'll lay the product on the person. You're going to see an increased blood flow and blood speed, and that's what really is Incrediwear is all about. Is about healing and recovery and trying to get oxygen and nutrients to the body really quickly. We've had the product on for about 2 or 3 minutes. Inside, the carbon molecules really get active when they're heated up. You can see the capillaries, the blood going through each individual one. The white blood cells are the bigger ones that you see that look clear as they go through. As we saw on the computer screen, we're talking maybe quadruple in speed, the blood flow going around the capillaries. So essentially when someone puts a product on, it's going to increase the blood flow, not only just to the area that it's at, but distally as well.
It's important here because this, the new thing is if you, I don't know if the video is on the PowerPoint or if it's on me, but if you notice in the video, we put the product and laid it on the person's arm. Yeah. And we had the increased blood flow into the fingertips. Now what we do is we put the product up on the brachial artery right at the armpit, and then we look at the capillaries in the fingers, and we get the exact same result. So it doesn't matter if you put the product down by the hand or at the wrist or at the elbow, as long as it's along the artery, it'll increase blood flow and blood speed, which is an important factor because oftentimes if you're just trying to get blood flow to an area, like on diabetes, it means that you don't actually have to wear a sock. Maybe you can wear an arm sleeve or a knee or, or a hip or whatever, if it's a wrist or whatever, you don't actually have to put it on the part. The most important thing to remember though is it's vibrating the cells where the product is. So if I have it up in the armpit, it's going to take away the swelling in the armpit. It's not going to vibrate the interstitial space down in my wrist or down in my arm. So it might not have the same effect as far as getting rid of swelling from there down. But the point is, oftentimes we look at an area that's super swollen, in a horse's leg, and we say, oh man, I'll tell you what, I'm going to put the product right on the area of injury. But it's really important to put it down the entire limb, not just to put it, on the area of injury, because I can actually put the product higher up. It's going to have a greater effect of trying to push the swelling out of the area, especially if it's a vascular issue.
Yeah, absolutely. And just to reiterate a point, that the technology, the semiconductor that's in here, like you said, you know, you plug your TV into the wall and you're pulling an energy source out of the wall to make your TV come alive. The same technology is plugging into the body. It's the body heat. That's the source of energy to turn this thing on. So it's kind of like a mobile phone that can run off the body. So this here is now working because it's taking that body heat as that source of energy that's making those components do their thing, making that, like you said, that resonate, that vibration, the tissue and cell action that leads to the function of this product. So, you know, on its own, it's inert, but then, you know, it's like, turn it on, put it on the body. And I like your point of saying, make sure that you're applying it to a generalized area rather than just a focal area, because we're going to stimulate blood flow and we're dealing with the area. So we're dealing with the blood coming into the area and we're dealing with the immediately affected area as well.
Yeah, it's a, you know, and there's a part of the cascade response to injury we talked about that is, remember we said heat and pooling of blood. So the part that we just talked about is about that, you know, the pooling of the blood and increasing flow. But really what's amazing, and I really can't demonstrate it unless we show videos, or and maybe we can do this sometime, is that we've done studies that show that as the horse heats up, we know that the body produces proteins that help protect it from more damage, especially when it gets to 45 degrees Celsius in that area. So we're doing studies on humans for that reason, but we can show that the hotter the horse gets by wearing this product. Normally, if you're hot and swollen, or if you have heat in your body and it's hot outside and you put on a jacket, it makes you hotter. But our product, it reaches a temperature where it causes an endothermic response. And, you know, Greg can get into this later, but if you take our product, this endothermic response causes an exothermic response of heat being emitted from your body and cooling your core temperature. And we're looking at limiting the amount of damage doing, you know, riding a horse when it's so hot, or a human that's exercising when it's so hot, because the vasodilation is such a critical part as far as performance goes. If we can keep that vasodilation down to minimum and there's less swelling, you're going to perform better. Let's take a look at what happens. You know, and we'll get into this, you know, if you take our product and you heat it, you know, with hot water, or if your body's hot enough, you just spray it with cold water, it'll actually it'll cause that response to be even greater, where it works as an ice pack. But let's go ahead and look at the results here so you can run through and see what we're doing. We're doing studies on, we just got approved for plantar fasciitis, severs. We just got approved for trauma right after an injury. You put our product on, and normally on an ankle, it would take 2 to 3 weeks before you can do surgery because there's so much swelling. The preliminary work that we're doing now with the #1 trauma hospital in the United States is 7 days. Now you can do surgery. Greg, you talked about earlier that the longer you wait to heal, because the healing process is taking so long, that's when the worst damage comes, when the normal cells start getting affected as well. Yeah. And so that's a thing, is if we can get rid of the swelling fast, your body is going to heal. Even the good cells are going to be able to get oxygen and nutrients to make your body heal faster.
And protected.
Yep, absolutely. This is an Olympic volleyball player, sprained ankle, grade 2, before the last Olympics. They put our product on, only used our product, didn't do any other ancillary therapies. And normally it's around, for an Olympic athlete, it's 24 days, and this is in 7 days. And she actually played. This was right before the Olympics. She played in the Olympics. And you can see it was perfect, didn't re-injure. She kept on wearing it during the Olympics. When you look at lymphedema, remember, this is, lymphedema kind of reminds me of a horse's leg, is that there's, you know, below a certain area, there's no muscle. So it tends to just pool. Everything pools down.
We have a condition in the equine, lymphangitis. We know it's swelling of the distal limb. Very much in the horse, you'll see it in the hind legs below the hock, and in the front legs below the knee, where they will just fill up. And that's that's a quite common condition that we see with horses that have, you know, in the winter where they've been out hunting, they get this sort of pooling, and sometimes it's a reaction to a cut or something that's actually triggered a response, and then you get the secondary sort of filling of the lymphatic tissue, and you get a filling of all the other tissues. But the problem is that drainage again. So you're getting this reaction, exactly what this is, that lymphedema. Then how do you get rid of it? And that's a real problem in the horse.
What is the current treatment for that?
A lot of it is dealing with the consequences of it, the pain associated. It's an incredibly painful condition. You try and use non-steroidals or steroidals to try and combat it. That's it. It's exercise. You know, get them to walk out a little bit. Try and get them to move the limb. But the problem you've got with that is it's a very uncomfortable condition once it sets in. So trying to get a horse to exercise, even just gentle walking around the yard, is incredibly uncomfortable for it. And no owner wants to really force their horse to be doing something they're uncomfortable to do. So it's a really difficult condition to manage.
You know, yeah, and this kind of goes along with what I was saying earlier, is that this gentleman, for an example, is that he had it for 7 years. They were going to amputate his leg. Is that his legs were so heavy that he could only walk about 20 meters, and then he had to stop, and heavy breathing. Then he walked 20 meters and his legs were fatigued. There no blood was getting to the cells, so they were getting fatigued. And I think that extra weight has an effect on him too. And so as we take a look at what he wore, is the same thing we use for post-surgery for ACL and total knees, and that's him 24 hours or 8 hours later. You can see the skin is even discolored at first because it's deoxygenated. You can see how much swelling is gone just in 8 hours. 1 year later, he stopped using our products except for like once or twice a week. And at night, he was wearing them 24 hours a day for the first 30 days. And now he's a surf instructor and he has no problem walking. It's crazy. It's amazing the difference. When we take a look at other lymphedema, this is, we're showing you these because they're human, they're easy to see, but the person can also talk and tell us. This gentleman had the lymph nodes removed as a result of testicular cancer. And you can see all the puffiness. This kind of reminds me of wind puffs, you know, on a horse. And you can see the swelling that's even with the sleeve on. And you can see 1 hour later. And this is while the person is just sitting around doing nothing. And then you can see 3 hours later. So the person did nothing, just sat around, very little compression, you know, so all it's doing is touching you.
This isn't a compression.
No.
The garment is not on tight enough to cause a real compression. It's laid over. I mean, dare you say, would it be the same effect if it was laid around or wrapped around?
Yeah, you know, if you take a look at the before one, that was him with his normal compressive sock on.
Oh, okay.
So he was wearing a compressive sock, took the sock off, and that's what it looked like. Yeah. And he'd been wearing these socks, you know, he had the testicular cancer for years, but we have the horses the same thing. Remember, once the tissue is stretched out, it does take time, and it might not ever go back 100% because now the skin is stretched, especially on humans. On horses, you know, we might be able to, you know, see a difference, but on this, the pooling never will 100% go away. But man, the difference for him is amazing. This is what we get post-injury. The person has an injury in their knee, but it's swelling all the way down to the foot. They put our product on, and this again is at rest, and this is 8 hours later. Just amazing difference. We look at the same on injuries. We're going to look at horses too, but humans are first. Look at this. This is post-surgery on someone that had a cancer removed from their face. They just lay the product on, and if you look, this is the same product, the same material that we use for our bandage wraps for horses that are working their horse. It's amazing how fast, you know, you can get improvement. Look at the swelling, you know, without doing anything, just laying it on you get rid of the swelling while your horse is working. That's why many of the sports teams right now are utilizing our products while they're doing their sport. And we'll get into that a little bit because the studies we have now, if you wear our product during the sport, you have less injury, so it prevents. This shows you post-surgery. This is a surgeon who had surgery, total knee, on day 3, you can see all the swelling. And just 10 days later, he's got full range of motion. Yeah. He's leg pressing back to normal, 240 pounds. And he has almost no swelling in his knee. He had zero pain as well. But the key is putting it on and wearing it 24 hours a day to be able to get that response. We're doing trauma, and this is going to be the same in the horse. This guy is an orthopedic surgeon that was in a car accident and then needed his foot amputated. In January, he came to me. We put our product on him, and just 4 days later, you can see the swelling. And you have a lot of horses as veterinarians that have these chronic issues that just don't seem to be going away because you've tried everything. But if you have increased lymphatic flow, you're going to allow the patients to get better faster.
Yeah.
This is actually rheumatoid arthritis, and you can see the discolored skin on the left is before and just after, the next day on both front and back. Pain-wise, it was almost totally gone. You'll see in the fingertips, the serous swelling. It just doesn't go away 100%. But this person now has almost no pain from her osteoarthritis or from her rheumatoid arthritis. We're looking at skin conditions, same thing, just wearing the product at night on eczema case. And this is just 3 days later. And then 1 week later, it's completely gone. The person who had this had never had this go away in 8 years, and now it hasn't come back in a year. So we have a lot of stuff, and I know that regenerative is one of the biggest things that is going on in equine, and we're used in regenerative. And regenerative medicine came from equine, and we're a big part of the regenerative process because we can limit that inflammation. Did you have something, Greg?
No. It's just interesting to see all the different applications and where this is going.
Oh, it's crazy. Yeah, I'm gonna go through these in just a second. But even on it, your horse has an acute trauma. This happens to be a guy who got hit by a rock. We see this a lot on kids that fall and land on their head. And then this is just wearing a product 8 hours later, and you can see it's almost completely healed. All you see is the area where the rock hit. But all the swelling is gone. There's no bruising. This is really, really amazing. This is actually the American Pharaoh, the Triple Crown winner, bit his veterinarian, and that's 8 hours later. So he was very happy that he had a wrist sleeve to put on, which was nice. When we look at flexor tendon injuries, that's one of the things we're always trying to study. Just by putting on our product, then again, there's no muscle below the knee. This horse was actually stuck in a stall, like you said, like a bathroom, couldn't move. I had a horse when I was growing up that had a navicular that was in that same space for 1 year. That was the treatment, or putting the horse down. And the horse could move back and forth, just stayed in place. So now you can imagine, the veterinarians and the horse owners being able to utilize a product that has that response. This is a flesh wound that was not healing for months and months. And then you can see that it actually got red after you starting to use our products, because now what's happening is for 8 months, actually that was 7 months, 7.5 months, hadn't been healing. And they had tried every treatment that they could think of. And this is just 17 days later, you can see, the wound is healing. It's now getting oxygen. Yeah. Each one of these products has a specific application. The circulation exercise bandages are made, you put them on about 30 minutes before you're riding. And these are going to be used while you're working. And wear them the entire time you're working. This is going to increase the blood flow, reduce the inflammation. When you get back to the barn, take a hose and spray them. And you spray them with water them down. They'll actually act as an ice pack for about an hour. Let the horse stay in them. When you're finished with that, this is more for exercise. Have them stay in that just while you're working. Then what you want to do application-wise is you want to put them in something that's non-compressive. That's a hoof sock. And this is for not just for navicular problems or laminitis or flexor tendon or any of these. It's for prevention. And so I would put these on, have them wear overnight, and I'd put them in combination with the circulation standing wraps, because on those together, now you have two products that are going to actually increase blood flow while at rest.
Yeah.
Then, the other one is just the neck sleeve. You can see the standing wrap. We use that while the horse is traveling. In fact, you use a combination of hoof socks and standing wraps for traveling, for anything that you're going to do where the horse is just standing still, or it's going to be sedentary for hours at a time. The circulation neck sleeve that we have is for, neck problems with nerve issues. And then the other product that's not on here is our new Hawk boot. And that one should only be worn for 8 hours maximum. And we don't like to actually have that particular one worn overnight. We like to put it on the day, take it off at the end of the day. That's the best treatment that we're finding right now for that particular product to be worn.
Perfect. Okay. Jackson, that's been a phenomenal insight into Incrediwear, and I hope the viewers are now a lot more informed, I'm sure you are, as to how Incrediwear works and how you can apply it to your own setting, how you can apply it to yourself and to your horse. And what we're going to be doing with Incrediwear and Jackson is we're going to be releasing some shorter seminars, some shorter videos on specifically how to use the bandages on horses or the wraps, and how to use them in the application of. But that was quite an in-depth one, so I appreciate that you stuck with it to the very end, and it really was a lot of information, because there's a lot going on in this product, and it was really good. And thank you, Jackson, for such an in-depth explanation as to how this worked and where it's been used already in high performance athletes, right down to general Joe public who are using it to get back their recovery from, say, a surgery, or even conditions such as eczema, and where it's been applied in the horse. So please post in your questions if you've got them. We'll pick up individual requests as time goes on, and there's a lot more information that you're going to get out of Jackson's head, I can tell you now, to how to use Incrediwear in the future. So thank you, Jackson. Look forward to seeing you again very shortly.
Absolutely. Thanks, Ray. Have a great day.
And you.